先月アメリカで初めて確認されて以来、急速に感染が拡大した新型コロナウイルスの変異株オミクロン。過去最多の感染数、各州で病院も逼迫している状況の中、早くから感染が広がったニューヨーク州は先週末、新規感染者数の峠を越えたと発表されました。ニューヨーク市がパンデミックの中、専門家の立場から市が行う感染対策に最前線で携わり、情報を発信してきた保健精神衛生局のチョクシ局長にニューヨークの状況や感染対策などお話を伺いました。
Dr. Chokshi, thank you so much for your time today.
Of course, thank you for having me.
First of all, now how did Omicron spread so fast in New York?
Omicron is one of the fastest variants that we've seen so far. We're still understanding precisely why. The way that I think about Omicron is I break it into three categories. The first is transmissibility. We do know that it spreads more quickly. The second is severity. Our preliminary data indicates that Omicron may be less severe than other variants like Delta, but I want to be very clear, less severe does not necessarily mean mild. And particularly if you are unvaccinated or you're at higher risk because of your age or another medical problem, it can still have very serious outcomes. We're seeing people hospitalized and dying due to Omicron. So it's something for us to take seriously. And then the third part of it is immunity. And this is part of the reason why Omicron is so formidable as a variant. We know that it evades the immune system, both natural immunity as well as immunity from vaccination. And that's part of the reason why it spreads more easily and you're seeing more people who are vaccinated get infected. But the important thing to emphasize is that the vaccines are still holding up very well in terms of preventing severe disease.
Omicron, that it's less severe. And we do see, however, within the United States, there's record high hospitalization. Can you explain to me why this is happening?
Yes, this is what's called the Omicron Paradox, in that it is slightly less severe, but we're seeing far larger numbers of cases. So even if you have a smaller percentage of a very large number of cases getting hospitalized, that can mean you have a very large number of people getting hospitalized.
Now, it seems like the cases are going down. Do you think it's going to stay that way?
I have to be very clear. We're still within the Omicron wave. Whether you look at cases or hospitalizations or deaths, we are seeing a very significant number in New York City. And I expect it will take several more weeks, for us to be out of the wave. But the thing that I always emphasize is that we have ways to shorten the duration and to protect ourselves. Vaccination is the most important thing, including getting your booster dose when it's time, as well as wearing a good high quality mask like a KN95, KF94, or N95, as well as using testing to help to make sure that you're not passing on the virus to others.
As for the booster shots, I understand that we can mix and match. But some people say that actually mixing is better because you get different kinds of immune system. Is that true?
We don't have perfect data on this yet. And so, my recommendation is if you got a Pfizer or a Moderna for your first two shots, either of those, for your booster is fine. For Johnson & Johnson, I do recommend that people get either Pfizer or Moderna as their booster dose. Because there is, although it's limited, there is some evidence, suggesting that has a better immune response. The most important thing is, as soon as it's your time, that means 5 months after your second dose of Pfizer or Moderna, or 2 months after your Johnson & Johnson shot, it's very important for you to get your booster. That will help protect you, especially during the Omicron wave.
先月、至るところで長い行列ができた検査会場。検査キットも不足する中、バイデン政権は感染対策を強化するため、家庭用検査キットを月に8個まで保険適用することを医療保険会社に義務付け、また国民に無料配布する方針を発表。保険適用は先週末から、 無料配布はオンラインにて明日から受付を開始します。
Is there enough testing kits right now in New York? There are huge lines a couple of weeks ago. How is it now?
The lines are much better now. We saw unprecedented demand for testing, and we more than doubled the number of testing sites, as well as distributed millions of at-home rapid test kits to increase our testing capacity over the last few weeks. So, testing is very easily available. If you're in New York City, just go to nyc.gov/COVID test or call 212-COVID-19 and you'll be able to access a test now.
Now, when you go to those testing places, most people take both the rapid test and PCR. Is that necessary?
There are some instances when if you take a rapid test, it may be recommended that you get a PCR test as well. For example, if you test negative on the rapid test, but you're having symptoms that are consistent with COVID-19, then I do recommend that you get a PCR test at the same time. But usually you're only doing one or the other.
So you're saying basically if you're just taking a test just to go to your friend's house or a family get-together, the rapid test itself is fine.
Yes, that's correct. And remember, if you're symptomatic, regardless of what the test shows, you should stay home.
So the home kit that we buy at the drugstores, how accurate is that?
Yes, well, pay attention to the specific brand. You can look at, there's a list on the FDA website to help figure out if a test is accurate. But if you follow the instructions in the test, most of those are accurate enough as long as you use them as described.
Now, CDC guidelines on quarantine is changing very often and it's very confusing. As a doctor, can you tell me what you think is an ideal quarantine system?
Yes, I do understand it's been confusing and changing, day to day, week to week. The most important thing is for people who are having symptoms, you should get tested as quickly as possible. And if that test is positive, you should isolate for at least 5 days. The CDC guidance says that after those 5 days, as long as you are asymptomatic or your symptoms are resolving, and as long as you wear a high quality mask, your risk in terms of transmitting the virus is lower. So it's okay to go back, particularly to essential things like work or school after that 5-day period. What I would just emphasize from more of the common sense perspective, if you're still having symptoms, if you believe that you may still be infectious, it remains important to stay home and to avoid passing the virus on to others.
So do you agree on that no symptoms, no quarantine that was brought up by CDC for the hospital workers?
Well, even if you're asymptomatic and you test positive, you do need to isolate for at least 5 days. So that's what I would recommend.
感染が拡大した年末年始、制限をつけながらもニューヨークでは恒例のタイムスクエアのカウントダウンを再開。感染者数が過去最多となった今回のオミクロン感染拡大の中、ロックダウンの対策は取られていません。
We saw a lot of people. Yes, it was outside. People were masked, but there were a lot of people. Do you think that was appropriate?
We saw what was happening with Omicron even in the beginning of December, the middle of December, and we adjusted things based on that. We took steps, particularly in New York City, to try to make those gatherings as safe as possible, ensuring that it was only fully vaccinated people who were gathering, making sure that people were wearing masks, improving ventilation by moving things outside, even in the cold, or at least opening a window or a door. All of those little things, they do add up to lower the risk.
Now, school began in January. Do you think the children were contributing to this Omicron wave?
We are seeing that children are both getting infected and unfortunately in some cases, having more serious illness that requires hospitalization. But it's important to realize that the amount of in-school transmission is relatively low. a lot of that transmission that is occurring, that is affecting kids, is from, community transmission and household transmission. And we've taken steps, to bring in layers of safety to keep schools as safe as possible. There's one other important point, which is when I reviewed the last week of December, 91% of children aged 5 to 11 and 65% of children 12 to 17 who were hospitalized for COVID were unvaccinated.
Now, businesses too, they're steadily keeping, New York City is steadily trying to keep them open, even during this Omicron surge. Do you agree with that as a doctor?
Yes, this is why we've encouraged, indoor mask wearing. Even if you're vaccinated, it's very important, to wear your mask, and optimally a high quality mask, as I mentioned. We also have passed vaccine mandates so that all employees have to be fully vaccinated. All of those things do contribute to the safety of businesses and to the New York City community as a whole.
In particular to New York City, what do you think is the biggest challenge going on from here?
The biggest challenge right now is, the strain that our hospitals are under. We're still seeing that there are numbers of patients who are being hospitalized each day. That means that it's more difficult for people to access the care and the quality of care that they need. In part, this is also because we're seeing that there are more hospital staff who have also gotten the infection. So those two things are being experienced together, and they have put our hospitals under strain.
So the other variants like Delta, is that gone or is it going to come back?
Delta is still circulating at a much, much lower level in New York City, and we still do have, some of the other variants.
Now, some people said when Omicron came in, some people said this would be the endemic and that this would be the last. What do you think? Is that true?
We will have to see. I hope that we are approaching the end of the pandemic, but it's just too early to say that. And I have a lot of humility making any predictions about the pandemic because this virus is wily and it has surprised us before. So we'll have to keep a close eye out on new variants, and understand them. But at the same time, we have so many more tools and we can prevent suffering in a way that was just not possible earlier in the pandemic.
So if there were to be another variant, do you think it's going to be more like Delta or more like Omicron?
One thing that we know is that it will have to be able to compete with Omicron because that is the dominant variant in New York City and most of the United States right now. Close to 99% of all of our samples are Omicron at this point. So anything that competes with Omicron will have to be similarly contagious. That means similarly transmissible.
One last message to our viewers, please.
I know everyone has been through a very tough time, and we've all banded together through it. The coronavirus has touched all of us, our families, our loved ones, but we do have hope on the horizon through things like vaccination, masking, testing, ventilation, staying home if you're sick. If we bring all of these things to bear, we will get through this.
Thank you so much.
Thank you. It's my pleasure. Thank you for having me.